Welcome back, everybody, to Videra University. I am with Dr. M. Hello, Dr. M. How are you?
Hello, I'm great. How are you?
Very good. And, of course, I'm with the ever-present Nurse Lynda. Lynda, how are you doing?
Namaste. I'm great, thank you.
Dr. P. What's happened to Dr. P this week? Have you two, I don't know, what have you done? Buried him under the floorboards? Okay, maybe you should not have admitted that on camera, Dr. M. Okay. We see nothing, we heard nothing. We know nothing. We know nothing. Okay, let's get on with the show then. This week we are talking about the whole person, and as usual, I'm very excited about this because I'm going to learn something new in the next 20 minutes because Dr. M and Lynda are going to teach me. Dr. M, why don't we start with you? What are we talking about when we mean the whole person? Because we never talk about the bits of the person, do we? What is the whole person?
Well, whole, that is the WH word, is really all-encompassing, and it's not just what you see in front of you, right? You know, me looking at you, me looking at Lynda, and you, me. We see part of the whole, okay? So there's something beyond the skin, the features, and so on. And so we include in the whole person the emotional person, the deep psyche, that which we hold in our bodies from the time of our conception. The person has so many features that are not seen but are experienced, that are felt. We are like computers holding a lot of data, and that's going to come out as we go on in life, one way or another. We're going to manifest all the experiences we've had. So we are a sum of all of our experiences, our genetics, and the thought processes, and so on and so forth. There's a whole lot to the whole person.
Dr. Emery, I just love the way you make complex things sound very simple. Your juxtaposition and combination of vocabulary, I just find always very engaging, as I do with Lynda and Dr. P. Lynda, coming to you. So, tell us more about what comprises the whole person. Go even deeper for us than Dr. M did.
Okay, so Dr. Maria is talking about all of our life experiences. Let's talk about where the patient is now. Where do they live? How do they live? Who do they live with? Are they alone? What do they like? What makes them happy? What makes them sad? The social determinants of health, which is something that, is not new, but relatively new, that CMS is asking us to do, will uncover those things. Are they living in a tent? Are they living under a bridge? Do they feel safe where they live? Are they socializing? Do they have hobbies? Knowing what's behind the facade, knowing because all of that drives the physical, the emotional, the spiritual, the all of that drives and derives all the clinical. It's all part of the whole. This is part of the whole.
Lynda, as always, so love your passion. You just love this business, don't you? No wonder you are never going to retire. And even if we tried, we wouldn't let you. But Lynda, stick it with you. Can I understand something though? Are people really going to share all this information with you?
They will if they trust you and you have a good relationship. And that is the basis for a patient-physician relationship. If that doesn't exist, if that trust doesn't exist, you can't care for them. You will never change their behaviors for better. if they don't trust you and have some kind of relationship with you. I think that's number one in any practice. Number one, other than do no harm, but you must have a relationship with the patient. And I find as a nurse, since I've been a nurse since dirt was new and I chose the color of it, you need to have a connection with them in such a way that they feel cared for. And that then opens the door for you to be able to change behaviors by getting them to understand why. You can't get them to do the what until they understand the why. And this goes back to last week's podcast, I think, a little bit, when we have to try to find that patient's hot buttons, the reason to change. But it is all based, everything. You can do nothing without that physician-clinician-patient relationship and a strong trust.
Thank you, Lynda. Dr. M, I remember once, about 2 years ago, we were on a Zoom call, and you guessed, I'm not going to repeat it on camera, and I don't want you to repeat it, but you guessed my weight to the pound. And it's not like you were being big-headed or anything, you just guessed it, it was right. And I said, how did you know that? And you didn't even answer me how you knew that. But you have obviously become super skilled at understanding the person. Tell us a little bit about that, how you've become so skilled. And do all doctors have that skill?
Wow, I don't know if I could really reveal that secret. That goes deep and far, and probably out of my hands. I've always been good at estimating. My kids are kind of spooked by my abilities to do that, because I know everything about whatever their size is, what's going to happen next. I'm not sure. I get a little bit of that spooky stuff that I have. I guess it's just, it's something that can be acquired, a skill that you keep looking at things, and you have a keen sense, an eye, an estimating sense. Some people are good at math. Some people are good at construction. Others are good at chess. I'm not good at chess. But I can pretty much call it when I see it. If I see something, I can pick up on it, and I can usually tell the person where they're headed. So somewhat of a psychic ability. With other things, of course, experientially, I've learned a lot, and so I have a lot behind me. So I'm not. I'm definitely not an amateur at that. So I can tell you it's something that I've had. And your other question was about, do all doctors, clinicians, nurses have it? I would probably say not entirely, no. There are people who just they don't get it, they don't see it, they don't have the analytic skills, they don't have the sensing. Why is that? It's their own makeup or their lack of something or things that they just can't put it together. So it's not something that everybody has, and they should really develop these skills if they're going to be in the world of medical care and healthcare.
Yeah. So tell me about. This is a difficult question because you won't want to be big-headed. So let me ask it in a slightly different way. Give me a couple of examples where your delving led to an answer that would have been hard to get in any normal scenario about a patient. So your questioning, your insights, your interaction, your care and trust in the relationship that was built. Give me a couple of examples how that you found out something that would not have been possible without all of those things that I've just mentioned.
Well, I just recently saw someone, I can tell you this was very interesting. The woman is someone who's suffering with some severe hot flashes, and asked me what to do about it, because she had tried all these different potions and formulas for menopause, like menopausal symptoms. She could not sleep at night, and like 12, 13 times getting up at night because of hot flashing. I asked her about past experiences, and I said, please tell me if there's one thing you can remember where you were in a scenario or situation. It was something I was picking up, and she said, well, when I was a kid, my father was set on fire. So she said one thing to me that connected directly with the heat, right? So it was uncanny how she just brought out a man on fire when she was a young girl. She saw him on fire. That's where I had to go. That's where we had to start opening something up, and she was kind of astounded that she even remembered it, but it was meant to come. So we put the connection together, so then I began to tell her how we would undo that and help cool her down and her dad, and to put imagery and so forth. So different techniques are used, but it just came out like that. Someone else told me of a terrible incident and trauma from his childhood, again going back in time. So I was able to have him understand why he was not able to communicate with his wife, because of something that happened in his childhood with his parents, and he witnessed some terrible scenario. So we go there, I go there, and then we try to work on undoing it. Just these things they're deeply felt, they are retained in the body. Like I said, with storage centers, we store the pain, we store whatever. It could be a wonderful experience that brought us to something wonderful in our life, but then it could be a terrible experience that manifests as an emotional illness or as a physical illness.
Doctor, thank you so much. Lynda, did you want to add something? I saw your hand go up.
I did. I wanted to address some of the things that Dr. Maria said. And first and foremost, you had asked, does everybody have this? Everybody has the ability to be aware. Everybody has the ability to learn to listen, to learn to see, to learn to smell, to learn to be present in the room with the patient. And that's what this is all about. The fact that she knew to ask those questions, anybody can do that. Anybody can do that. Anybody can learn to be aware in the room with the patient to ask the right questions. It's not always about giving a pill. It's not always about treating with something. In many cases, it's exactly what Dr. Maria is saying, to get to the root of the problem. And that's where if we fail, I believe that's where we fail. Everybody wants a magic pill, rather than finding the root cause of what their issue is and working.
Do the patients want that too, Lynda?
Pardon?
Do the patients come to you and they say, I just want a pill? Do the patients do that too?
Oh yeah, I've got this. Fix it. Fix me.
Fix it.
Give me something to fix this.
Give me a pill to fix it.
Give me something to fix it.
That's do they appreciate there are often downsides to pills as well as fixing it?
No, we have to educate them. We have to educate them to that every pill, the PDR, the physician desk reference, is this thick for a reason, and teeny tiny print, smaller than a Bible, because every single thing that you put in your body has a fortunately and an unfortunately. If you read the PDR, you'd take nothing. And it's easier to be handed something. And it's almost like the a fee for service kind of thing. I came to you with a problem. Give me something that's going to fix that problem. It's like I'm buying something to fix the problem.
Yeah.
And it takes a special person to go back to the basics. Again, this is what we talked about last week. To go back to the basics of medicine, to go back to the basics of clinical practice, to get to the root, because you can plaster cracks. But if it's the basement, if it's the foundation that's moving and the problem is in the basement, that plaster is going to fall off. That crack's going to keep coming back. So the plaster is the medication. The problem is the foundation. You don't fix the foundation, you're never going to get the problem fixed.
So I want to turn, thank you, Lynda, appreciate it. And both of you, as usual, every week, thank you for my free education. I'm loving it. What's not to love about it? I'm getting educated free of charge. But I want to go to a particular question, and that's, Lynda, you said one of the things that comprises the whole person, are they happy or are they sad? Okay, so exactly, what a silly way to put it. What difference can it make to a person if they, from in terms of their overall health, from being sad to happy? Dr. M, why don't you go first on that, and then I'll ask Lynda the same question.
So, can you clarify that just a little bit?
So, one of the factors that Lynda mentioned about the whole person, are they happy or sad? Okay.
Right.
What are the benefits, health benefits that flow from moving from somebody being sad to somebody being happy? And there's a follow-up question to this afterwards, but what are the health benefits that flow from becoming more happy?
Well, first of all, in a sad state, and sad, there's a spectrum of sad. You could be a little sad or very sad, and then there's depression. So depression is a very dark place. But to get out of that low vibration state, which it is, you're in a low vibe state. You're in a state where you're very vulnerable to just about anything. You can be taken advantage of. You can, you can just submit to anything. If somebody has something to say to you, like it pull you up, you'll just submit to it, and regardless of whether it really will have the best outcome for you. So you're very vulnerable. Your immune system is generally on the lower end. So the low frequency state has you in a very detrimental state. So I would say it's best to get out of that state right away and to uplift. And there are many things to do that, many ways to uplift oneself or a person. Usually when somebody's bummed out, they're by themselves. It may be hard for them to take themselves out of the sad state. It's a good idea. I would always recommend that people reach out, call someone, go outside, go somewhere, provided that, it's somewhere where you're not alone, best to go out where people are, or animals, or something to really bring you up, to bring up your vibes. Go out in the sun. The sun is a very charging element in our life. It gives us life. So you want to charge your battery. Your battery's kind of low when you're sad. So you want to charge the battery, and the sun is a wonderful charging agent, the best as far as I'm concerned. So you want to bring up your vibrations, and you want to build your immune system, and you want to be not vulnerable anymore. So the benefit is to remove the vulnerability and to increase the resilience, the resistance to infection, to other diseases.
Massive benefits then. So Lynda, you can't make somebody happy, right? Dr. P would like to think he makes people happy because he thinks he tells great jokes. But, the three of us aren't laughing, are we?
I have no. Although that's funny. What you just said is funny.
So,
love it.
we'll play this back to him. We'll play this back to him and see what he says. But
Oh, he'll have
you
something
can't
to
make
say.
somebody happy unless you're Dr. P. But you can't make somebody happy. What do you do to get them to become happy? What's your technique? And
Well, first of all, I want to take this to a different level. I want to take this to the cellular level of the body.
Okay.
We are made up of, I don't know, it's a huge number, trillions, billions, whatever the number is, of cells. And each individual cell is an organ unto itself. And all we really are, is a massive amount of chemical reactions. That's all we do. And I can't even tell you how many chemical reactions are happening right now just to move my lips and make these sounds. I'm taking it really down to the microscopic level here.
Okay.
About
And
quintillion.
we
How many?
create.
About quintillion. Every.
Quintillion.
Thank you.
Okay.
I'm not
Okay.
a mathematician, so I don't know
So
those words. But
as
at any
Dr.
rate,
P would say, would say, that's a few more than a lot. Yeah.
yes, few more than a lot. Well, if that's what we are, and we create chemicals out of the chemicals that we ingest and breathe in, however we get them in our body, and we create our own called hormones and other chemicals that fire our neurons, make our nerves work, make our muscles work, the whole 9 yards. That's all we are. So what we eat, what we experience, what we ingest, what we breathe, and all the medications all those magic pills we're giving everybody, all these chemical cocktails are now affecting us at a cellular level. So that's the one thing I wanted to say. But how to make somebody happy is to first find out what's making them sad. Are you alone? Are you lonely? Can you not find joy in finishing a puzzle, in listening to a bird sing, in looking at a beautiful flower or a garden, in just being? Can we find some kind of social activity, even playing cards or listening to music or going to a play? Can we not find something? But the first thing we have to do is find out where it's coming from. Again, it's the listening and being aware and knowing to ask the questions. If you never ask the question, you're never going to know the answer.
Mm-hmm.
And if you're aware, if you are cognizant and aware in the room with a patient, it's more than what they say that tips you off. It's how they look. It's how they're dressed. It's how they smell. Do they make eye contact with you? Are they looking down? Are they very soft-spoken? What is the cadence of their speech? These are all clues as to where they are, and you cannot make someone happy. But you can find out what makes them sad and try to move the meter a little bit.
Move the needle a little bit. Yeah. You know what? The reason I brought that up is because just what you said earlier, Linda, about patients come in with a desire. Many patients, or some, come in with a desire for a pill, and there are better things to do. There are better, find ways to become happy. Drink more water. There are foundational things to do, from what you guys are saying. That before you get into the pills. I tell you, as we're heading to the finish, I've got one more question coming up for each of you. It's the same question, and it's your sort of one key takeaway, one piece of advice for everybody. I'm going to say my key takeaway from this week, and that is that as a human, I have an obligation just to make sure that I don't make anybody sad unnecessarily, and if I can, make as many people around me as happy as possible. So, if everyone did a little bit of that, maybe fewer people would need medical advice. But that's my key takeaway. Dr. M, what's your key takeaway from the week, and one piece of advice you'd like to offer our viewers?
The most important thing that each one of us should do is want to appreciate and love ourselves. We have to really respect and love the self, because you are carrying yourself for your whole life. And if
Yeah.
you become loving and respecting of yourself, you'll bring your own spirits up and help to bring other people up as well, who may around you not be so much in love with themselves. Teaching other people to love themselves, that's something that I try to do. You have to start with yourself, and then you can impart that to others, and to know that they are comprised of so much, and we are, like we were talking about, whole. We have whole. Whole is really an extended word out into the complete atmosphere, universe, galaxies. We are part of something that we cannot even measure anymore. It's just immeasurable. It's infinite. So we are part of each other, and we need to bring each other up, help each other all the time. But it starts with you. It starts with yourself. Love yourself. Learn to love yourself. Respect yourself. Do the best for your body. And try to eliminate all the negative energies. Stay away from negativity. Negativity will bring you down, and that's something I try to tell everyone, to stay away from negativity, and don't generate it either.
Brilliant advice. I'm going to take as much of that as I can, Dr. M. And what about you, Linda? Well, your key takeaway and any advice you want to give me and viewers?
Well, I can't say it enough, but in order to and I agree 100% with Dr. Maria, it has to start here. It has to start with you, because if you're miserable, I don't know how you can help anybody else. I mean, the saying, misery loves company. Well, it does. And you're not doing anybody any favors by taking that into your clinical practice. So, or anywhere. I mean, you yourself have to find a way to find joy. For me, go to the beach. I'm happy as a clam. That's my, oh my God. But the key, what I would like everybody who listens to this podcast to understand, is that we can't affect anything. I can't make someone else happy. All I can do is find out, or try to be present enough and aware enough, and know how to use my skills to listen, to touch, to empathize, to understand. That's number one. You have to be present in order to do that. Create that atmosphere of trust and understanding, and have the patient know that they trust you and feel your concern, and then be able to listen for the root causes of what's making them sick, what's making them unhappy, what's making them feel unworthy. Whatever it is, there is a root cause somewhere. There is a root cause, and you have to be aware in order to find it.
Thank you, Linda. Thank you, Maria, Dr. M. Thank you both. That's the end of the show, but I do want to say before we go that I've now got a busy few hours trying to find out what you two have done with Dr. P. I'm going to send a search party to go and find him. And if I find any evidence that you two were, there'll be trouble. There'll be trouble for those of you. Thank you, Maria. Thank you, Linda. Until next week. Really
Thank you.
good to see everybody.
Bye-bye now.
Ciao, Bella.